you should have seen the trays full of food that were brought inpatient and what we're supposed to eat to prove that we're better enough to go home. It was prepackaged in plastic, huge muffins and pancakes and cakes and pies and cookies. And that's what we were told. Eat this, show us that you're better, and we'll let you go home. And none of that does anything nutritionally for your brain. It's just causing more inflammation and causing more malnutrition. It's just horrible, and there's nothing that's changed. I have since gone back and come alongside some young ladies that are inpatient right now, those who have reached out to me in my local community, and I've visited them in the hospital. The same 3 toxic ingredient tube feeding ingredients are still going through their tube feed 6 times a day. And those same trays of food are still being served to them to prove that they're better to go home. The protocol has not changed at all. They're, the powers that be are still utilizing the same failed treatment, and they just keep doubling down and just doing it more. They will never open up to the fact that this is not working, that they let these fractured young men and women go home, and they're on the way home, they're already thinking about relapse. They're already thinking about how they're going to lose what was put on them while they were inpatient, and they immediately go back to starving because nothing has changed mentally, no matter how long they were in treatment. And that's how I was all of those decades. There's just an insurmountable amount of suffering that goes on between schizophrenia and anorexia and all of these extreme mental illnesses that is just devastating. It doesn't ever get better. You just teeter on the precipice of being tolerable and trying to smile and trying to get through your day. And it's always looming over your shoulder, ready to take over again and pull you down. And that's no way to live. That's no way for a doctor to look at a patient and say, this is all we can offer you, that you can be quote unquote better, but you'll always be disordered, and that you'll always have to deal with this for the rest of your life to in some degree or another, sometimes severe, sometimes less severe. That's a terrible diagnosis to give someone, and it's not right.
Yeah, it isn't. And I really like, the way that you're coming at this, which is, treating mental, the anorexia and eating disorders in the same way that you would treat a mental health issue. You have to address the mental health part of it. And it's not good enough to just tell someone, hey, you're not hearing voices, those aren't real, and tell me you're not hearing them. Just tell me you're not hearing them, and then I'll let you go. Okay, I'm
Right,
not hearing them, and then you let go. I'm like,
right,
okay, well, that wasn't working. It's the same thing as saying, it's like, well, just eat the cupcake and we'll let you go home. It's like, okay, I'll eat the cupcake and then I can go home and get back to doing what I was doing. It's not actually addressing the issue, which is it's a mental health issue, and you're not just going to convince them that cupcakes are good. First of all, cupcakes are not good, so that's stupid anyway. But that's not going to work. This is not a conditioning issue. This is not an education issue. It's a mental health issue, and feeding them garbage and pretending that, oh, okay, yeah, I don't have a problem with that. How is that going to help? I mean, that the recidivism rate is nearly 100%. That as soon as you get out of there, you go back to doing what you were doing. It's very, very difficult. So addressing it like that, and addressing the mental health part first, like you said, oh, let's put on weight, and then your mental health will come along with it. Well, clearly not. And that
hmm,
if you put on weight, well, then the only reason your mental health change, all this stuff because you put on weight. Well, I mean, that doesn't even pass the smell test because there's a high correlation and concordance with metabolic syndrome, metabolic disease, obesity, with mental health issues. And like schizophrenia and depression, OCD, bipolar disorder, all of these issues, there's a very high correlation with these metabolic health issues and obesity. So, and that's the other thing too. They'll say like, well, your mental health issues got better because you lost the weight, and your mental health issues got better because you gained the weight. Well, which one is it? Gaining weight or losing weight? Which one does it? You know,
Huh?
it's not that. The thing that helps your mental health also is helping your weight either improve and optimize. You're just eating real food. That's good for your brain. Last time I checked, the brain was part of the body. And so when you're eating food it's good for your body, you're getting nutrients for your body that includes your brain. And if you're not getting the right nutrients, if you're not in the right metabolic state, if you're bringing all these like very inflammatory factors that come into your body and screw with your brain chemistry, damage your mitochondria so they can't function properly in your brain and elsewhere, things aren't going to work. I think it would be amazing if they could, I look at the hospital, obviously the food there is just atrocious. It's just sugary carbs for every, breakfast, lunch, and dinner every single day. And if there's meat, it's just one little sad, lonely piece of dried, you know, very lean, overcooked piece of meat that just looks like foam rubber and probably tastes worse. And the rest of it's just sugary carbs. And so the TPN, what we give people for IV
Mhm.
nutrition is atrocious. It's just tons of
Mhm.
just sugar and carbs and garbage like that. And then the feeds are just the same thing. Why are we giving people sugar? Like, how is that something that we should be giving in hospitals?